So we will continue with the cats with their osteology and internal organs. It's a fairly short topic. And for osteology, so the cats have a total of 224 bones. That's for adult cats. So pretty much they're smaller, thus they have smaller number of bones in comparison to the dogs that do have 320 for males and 320 for females and 321 for males. Sorry. The Oriental breeds, such as the Siamese, have longer faces and wedge-shaped head. And the Persians have pushed-in faces, that some Persians' pushed-in face is exaggerated, causing them blockage of the tear ducts. These are also some of the breeds that all airline companies that service here in the Philippines do not allow um in their cargo, because they're considered as cargo because they really have shorter snouts and it can kill them, especially when they are in areas, because there are times the reason why when you really have to go on an airplane, if you're going to ride an airplane, chances are there is a fluctuation on the air pressure, particularly in the cargo area. So there are times that the air pressure is very high, very low in oxygen. Thus, you for for a while, the dog, especially, or animals with short snouts, do has this tendency to pass out. So the airlines have issued these, I think, starting 2018 or 2019, if I'm not mistaken. I'm going to check with that memorandum. Also, the eyes and orbit are larger and more forward compared to the dogs, and they have interparietal bone. So you have here the Siamese. So they have longer heads. And then you have the Persian with the pushed-in face. So feline ventral nasal conchae is smaller. That is compensated by the enlargement and development of the middle concha and its lamellae. They have paranasal sinuses also, the frontal, sphenoidal, and maxillary. For the vertebral formula, like all mammals, they have 7 cervical vertebrae. Like the dog, they shared 13 thoracic vertebrae, also 7 lumbar vertebrae, and 3 sacral bones. The only thing that differs between them and the dogs are the caudal or coccygeal. The ventral deflection of the transverse process of the lumbar vertebrae is more pronounced in cats, and the dorsal borders of both scapulae are very prominent and bound to hollow over the adjacent part of the vertebrae, so meaning it's normal that you can actually feel their dorsal borders. The British short-haired cats are often described as cubby, which means short, thick neck, and a thick, deep, and fairly short trunk that is carried rather close to the ground. And the only breeds of cat that is considered as tailless is the Manx. So for the ribs, they have a total of 13. And of the 13, 9 are sternal, 4 are asternal, and they don't have floating ribs. For the thoracic limb, their scapula has an acromion and a suprahamate process, which is an extension of the acromion. They have clavicles that enable them to squeeze into tight spaces. However, the clavicles, unlike in the chickens, which we will later learn, and in humans, is attached to a bone. This one is just for muscle attachment. And this is the reason they can squeeze into tight spaces. Also, cats have loose jointed carpals that can rotate inward, thus they can swat or scamper up a tree. Their claws are laterally compressed, strongly curved, and drawn out to sharp points. Their claws can be fully retracted into fur of the paws, thus cats are able to walk silently and without blunting the claws through ground contact. The 2 elastic dorsal ligaments, they have 2 elastic ligaments on these claws. So the long ligament, which extends from the proximal interphalangeal joint to the sides of the distal phalanx, and the short ligament, which extends between the distal end of the middle phalanx and the top of the ungula or unguicular process or crest. The cat's claws, its position, this disposition combined with the obliquity of the articular surfaces will allow the base of the claw to be drawn laterally to the corresponding middle phalanxes from Dyson-Wensing. And to protrude their claws, cats simultaneously contract the deep digital flexor muscles which flexes the interphalangeal joint and the digital extensor muscles which stabilize the more proximal joints of the paw. So this is how it looks like. So the superficial tendon, and you have the elastic ligament over here, and you have a digital flexor tendon. It's actually deep digital flexor tendon, and it's a claw. So that's the reason why they can retract their claws. So these are the mechanism. Sorry. For the oscoxae, so cranially both ilia diverge slightly, producing a funnel-shaped entrance to the pelvis, and the wings of the ilia are smaller and more shallow, which eases the transition. The ischial or ischiatic tubers are close together, giving the pelvis a more rectangular appearance into the ventrodorsal view of a radiograph. They have a very narrow perineum, and they have no sacrotuberous ligaments, making them more flexible, particularly in this area. For their eyes, so the feline lacrimal system is similar to that of the dog. The only difference is that there are some cats that have openings in the oral cavity, which is located on a small papilla just behind the upper incisor teeth. And I think you saw it with the pig. They also have that. All kittens are born with blue eyes, which later change in color to either green or amber. And usually kittens that have blue eyes, they're usually at the age less than 3 months. When dilated, the domesticated pupils are round. However, some wild species have their pupils remain round all the time. Examples of these are your Bengal cats. If constricted, their pupils form a vertical slit. This is due to the dorsoventral orientation of the muscle fibers that extend to the periphery of the iris and dissociate at the extremities of the pupil. Their oral cavity is short and wide, and their tongues are rough and abrasive due to the strong keratinization of the epithelium of the large conical papillae instead of the filiform papillae as seen in other species of animals. These papillae are directed caudally and are hooked. Aside from the diffuse labial salivary glands, the cat's lips have sebaceous and apocrine glands, which are used for grooming and as scent markers. So if your cat will try to snuggle on you and make baiid in our language, that is that cat is marking you. Siamese are prone to congenital primary hair lip, and cats have incisive papillae, which is located caudal to the maxilla's first incisor. So they have an incisive papillae, which tears will also flow in there, and rostral to the first palatine rugae of the hard palate. Cats only have 473 taste buds in comparison to humans' 9,000, and they cannot detect sweet. So this is how they look like. This is their tongue. It's very rough. It's widely for wild cats. This is the reason why they can lick off the meat, the remaining meat from a bone, it is because of this one. And you have the incisive papillae. So this is their dental formula. So for deciduous, they have a total of 26. For permanent, they have a total of 30. So we are now in their digestive system. So their stomach in particular. So it's sharply flexed on itself, and the pylorus reaches little in the right half of the abdomen. Gross distension is less common in cats due to its moderate appetite. They have fewer and smaller rugae than in dogs. However, for applied in clinical anatomy, Siamese are prone to pyloric stenosis. This is a condition characterized by the circular smooth muscle of the pylorus being too narrow. Now we go to the heart. So the heart extends from the third or fourth to the sixth or seventh rib. Little is covered by the forelimb in the standing animal because the triceps brachii reaches no further than the fourth rib. Since the long axis of the feline heart forms a more acute angle with the sternum, it resulted in a greater area of sternal contact than in dogs. For point of maximum intensity for the mitral valve, left side, fifth and sixth intercostal space level with the shoulder joint, while the tricuspid valve is fourth and fifth intercostal space at the end of the shoulder. So this is on the right side. For the kidneys, so you have here kidneys, and you have a bladder stone of a cat. So this are their kidneys. This is their kidneys. Very beautiful. So the kidneys are relatively larger than in dogs and are readily palpable and have distinct appearance by capsular veins converging over the surface toward the hilus, and it's mobile, especially the left kidney, and it's red to yellowish red due to presence of intracellular fat. By the way, you better research on their kidneys because they have these vessels on the cat kidneys. So that is an assignment for you guys. So what are those blood vessels that are present in cats, particularly on their kidneys? For scrotum and testicles, so cat testicles can be found below their anus, and because of the caudal position of the scrotum, the spermatic cord in toms are long, maybe due to the weak cremaster muscle. And if you notice, of all the animals that we have discussed so far, the toms location of their penises is not when it's erect or it's being aroused. It doesn't move cranially, but it goes out caudally, unlike most of the domestic mammals. So for accessory glands, prostate gland, it's located 3 to 4 centimeters caudal to the bladder's neck of the bladder. And they lack ampulla but have a small bulbourethral gland located on the urethra at the same level of the ischial arc. Penis. So their penises are unique among domestic animals because it retains its embryonic position, so right below the anus. And apex is directed caudoventrally and the urethral surface is uppermost. Distal part of the corpus cavernosum ossifies to become an os penis. And the kittens lack os penis until they mature to 3 months of age. The dorsal artery is the only one that supplies the prepuce but do not supply blood to the penis. Its glans is small and its free surface is generously ornamented with small keratinized spines in the thumbs. That's from Dyson Wednesday. And approximately around 120 spikes. And these spikes provide stimuli to the queens since they are induced ovulators. And the prepuce is thick but short with lots of hair. And the prepuce opening faces caudally and urine is ejected in this direction. And the thumb's penis increases considerably in length upon erection, then curves downward and forward. So this is how it looks like. And this is a closer look of their penises. And we are done. So on our next topic is the first topic for avians. It's introduction and osteology.